All right, guys, welcome to this medication review. What we're going to do is review tranexamic acid, or TXA. So TXA is an antifibrinolytic agent that has really been emerging in pre-hospital use over the past, it's been around for over a decade, but really seems within the past 5 to 8 years, the use of this antifibrinolytic agent, TXA, in the pre-hospital setting is actually seems to be gaining support nationwide. So how TXA works is it actually prevents breakdown of blood clots within the body, and it does this by binding to receptor sites on plasmin itself, which prevents the plasmin from binding to the fibrin and actually breaking down the blood clots that have formed in the body. So think of it as binding to the receptor sites on the plasmin, kind of in the same way that Narcan binds to receptor sites, for narcotics within the body. And then by binding those receptor sites, it keeps the plasmin from actually being able to attach to the fibrin, which will actually, lead to the breakdown of the clot itself. So it's not breaking any clots apart or keeping or actually forming clots, I should say. It keeps a body from working against itself and breaking down the clots that it's actually forming to help control hemorrhage within the body. So indications, the number one indication specifically in the pre-hospital setting and what we are going to use it for is going to be to deal with significant hemorrhage that is secondary to some sort of traumatic event. This is hemorrhaging that we cannot deal with by traditional means. And I'm not talking about an external hemorrhage that can be dealt with direct pressure or even with the use of a tourniquet. This is dealing with those significant hemorrhages. Let's think of internal hemorrhaging, maybe abdominal hemorrhaging, things like that are directly related to some sort of traumatic event. That is our go-to use. That is the indication of use in the pre-hospital setting by paramedics. So our indication is significant hemorrhage secondary to trauma. This medication is also used in the hospital setting to prevent significant blood loss during surgeries. It is used to reverse the effects of anticoagulants, and there is some use out there and some studies that are being performed right now on use of TXA for treatment of heavy menstrual periods in the female population. Contraindications for this are pretty easy. Hypersensitivity. If they have no allergy to TXA, we're not going to give it to them. That being said, most of your patients, when you're administering TXA, have probably never had it before. But we do need to be mindful that if they do have a known allergy to TXA or antifibrinolytic agents, we need to stay away from administering this medication. So dosing of TXA, first of all, we don't use it in the pediatric population. It is not recommended for use in pediatrics. We don't have enough data on it that supports use specifically in the pre-hospital setting by the paramedics, so we will not use it in the pediatric population. But for adults, the traditional dosing that we are going to see in the pre-hospital setting for those trauma patients is going to be 1 gram administered via IV piggyback over a 10-minute period. So we're going to infuse this or drip it into the patient over a 10-minute period. And then after they get to the hospital and have further definitive care, they should receive a follow-up dose of 1 gram infused in over the next 8 hours. So how do we facilitate this drip? What we're going to do is take our 1 gram of drug, we're going to put that into our 250 cc bag of saline to make our drip, and then we're going to drip this in over a 10-minute period, which is going to be, for the most part, wide open. A lot of protocols will tell you that this is the one drip that you're not going to use a 60-drop set on. You're going to use your standard macro tubing or your 10 to 15 drop set, and they'll tell you that you're going to give between 2 to 4 drops per second to make that happen. So again, 1 gram mixed to 250 milliliters of fluid, and we're going to drip that into the patient over a 10-minute period, and that is how we're going to administer TXA to our trauma patients. Again, primary use for us, significant hemorrhage secondary to trauma. Again, this is probably going to be an internal hemorrhage that we cannot deal with through traditional means, being direct pressure or use of tourniquets. This is used to address the hemorrhage that we are not going to be able to have any control of because of the location within the patient's body. So take a look at this. I encourage you to take the time to look at your local protocols, look at use in your local area and see what the dosage is there, and maybe dive into this a little bit. There's a lot of really good literature out there related to several studies that were performed with TXA that have proven the validity of use in the pre-hospital setting by paramedics. So hope this helps you with your review. We'll see you on the next one.